Welcome. In less than 5 minutes, we'll be starting a live Ideas, an Ideas Engine live bulletin with Charlotte and Boo. And Charlotte has two distinguished guests, members of the COVID-19 Peer Hub, who are working to keep immunization, vaccination going during this pandemic. Edda from Kenya works on both national and subnational level and will be sharing what she's been doing with monitoring and communication around immunization data to the community to work on coverage during the COVID-19 pandemic. And then Jyoti from the district hospital in Pune, working at the district level, will be sharing actually how she has been exploring online training during the pandemic. So we'll see you in less than 4 minutes. We've got two great guests, and Charlotte will be interviewing them, bringing you voices from the field to really share experience in practical ways with other immunization practitioners and others interested in what is happening with the pandemic. Thank you, and see you in 3 minutes and 20 seconds. Right, in less than 2 minutes, it's time for an Ideas Engine live bulletin with Charlotte Mbu. She'll be welcoming two guests, Edda from Kenya and Jyoti from India. Both are immunization practitioners working at national for Edda and subnational level, district level for Jyoti. They'll be sharing what they've been doing during the pandemic to keep vaccination going in the face of this pandemic, so that every child who needs to be protected from vaccine preventable diseases can be so. So in less than a minute, we'll see you then. Warm welcome to you. This is a special edition of the Ideas Engine Live Bulletin with Charlotte Mbu. Special because we've been so busy with the Peer Hub, with the Impact Accelerator, that Charlotte rang me about 15 minutes ago to tell me she has two amazing guests who are ready and waiting to share. So two members of the Peer Hub from India and Kenya, with two very different contexts and perspectives, but both with practical know-how and experience in how to keep vaccination services going during the pandemic. Charlotte, how are you doing? And what have you got for us today, or who, I should say?
All right, so good evening to you, Reda, and thank you. And good morning, good afternoon, good evening to everyone that's joining us for today's live Ideas Engine Bulletin. And so this evening, I have two very special guests for us, Reda, and it's Edda Kanini, that's from Kenya, and Jyoti Londe, that's from India. And they are all scholars from the COVID-19 Peer Hub. And I'll allow them to tell us in more detail tell us more about themselves and what they have been doing within the context of COVID-19 as far as maintaining immunization services is concerned.
So we want to focus really on the projects they developed in the first 6 weeks of the COVID-19 Peer Hub. So let's get specific and keep it moving. Who's first?
Exactly. So I'm going to turn to Jyoti Londe. Jyoti, your mic is already unmuted. So good evening to you. Please unmute yourself. Can you tell us who you are, where you work, and what you have been doing?
And also, if you could turn on your video, that'd be great.
Hello.
Yes, Jyoti, go ahead.
Yes.
We are getting you.
Yes. Myself, Jyoti Londe. I am working as a sister tutor in District Hospital, Pune. I am in public health services since last 20 years. In Maharashtra government service, public health service. As being a tutor, I am involved in very much in service trainings also, and training of the students also in nursing area. So I am a part of a Peer Hub since March when there is a beginning of COVID, and all system is engaged in response to the COVID.
Okay. All right, thank you very much, Jyoti, for telling us more about yourself. So now I want to turn towards Edda. Just stay on, Jyoti, because I'll get back to you with the questions in a short while. So Edda, please, can you unmute yourself and tell us who you are and where you work?
Yes, thank you very much. Good morning, good afternoon, good evening to all who are joining us. My name is Edda Kanini. I'm joining from Kenya. I'm a monitoring and evaluation consultant in public health with a background in public health. And I'm also a trainer and a lecturer teaching in the College of Health Sciences in one of our universities. And I work mostly with the national and subnational, which we call county, national government in terms of health system strengthening. Thank you.
All right, thank you very much, Eda. So I'm going to ask you the first question for today is what happens after the start of COVID-19 with your context that made you think that it was essential for you to focus on the specific challenge that you want to address? You may want to tell us about the challenge and why you thought it was important to handle that. Eda?
Okay. For me, one thing we all know, when the pandemic came, what happened in all the countries, there was the immunization level went down. That's in addition to other services. And when we started picking up, when countries started organizing themselves, I felt, yes, we were doing a good thing in terms of, trying to reach the children there in terms of immunization. But there's one aspect that is usually left out mostly, which is very important, and that's the aspect of information, data sharing, communicating to the community. We communicate a lot between ourselves, but there's a group out there that is left wondering what's going on, what should I do? I felt it's good if they're also involved, kind of to feel involved or to own up the activities that we are doing as healthcare workers in terms of helping them. We should also integrate them to be able to help them and also help themselves as the community. And that's why I came up with this idea of, showcasing or communicating how the immunization state is going on in health facilities, but to the community. Those who are coming, they are also very good advocates when they go out there to their fellow community members, fathers and mothers, to bring their children for immunization. So that's how my idea came. But it's not a new idea, and it's not an idea that replaces other ideas. It strengthens other ideas in bringing immunization, up, especially this time of pandemic. Yeah.
Thank you, Eda. Just one little question. Why did you think that this was more important now within the context of the pandemic? In just 2 words, please.
Yeah, it's very important. We know definitely the community participation went down, and there was a lot of fear going on in the community. As much as maybe many parents or many caregivers would have loved to bring their children for immunization, they did not know exactly what to do. And in addition, they did not know something also that was really adding the fear or uncertainty is that they don't know what the healthcare workers are doing. So coming to a health facility, even if it's one person, and being able to see visually that, the data is either going up or going down, they are able, to go and spread the word. That's why I really needed at least what we are doing as the healthcare workers to portray it in a very simple way, either through charts or whiteboard or a blackboard, just in a small space, and show how the work is going. That way the community also owns the, the data, the information itself.
Okay, thank you very much, Eda.
Yes.
Yes, Reda.
I thought you said Reda, but you said Eda. So,
yes.
So that's my excuse for interrupting you. So we have we have a lot of greetings from Nigeria, from India, from from Ghana, from do we have anyone from Kenya yet? From Cameroon, and we don't have any questions yet. We also have Rajat Garg, who says, "Wonderful, Eda. Great to listen to GOT, and welcome, Eda." That's from Dr. Tanushri Mandal. And we have some very nice greetings. We're waiting for, I think, participants are waiting to understand really what concretely Eda has carried out before asking follow-up questions. Over to you, Charlotte.
Okay, thank you, Reda, and greetings to those that are joining us via Facebook. Okay, so I want to, before we come back to you, Eda, for more details on what you have been doing, I want to turn towards GOT now, and with a similar question to that which I asked Eda a while ago, which has to do with what happens in your context that made you to come up with the with this action plan that you drew up within the COVID-19 Peer Hub in relation to addressing a specific challenge that you are facing? So, Joyty?
Yes. Actually, I have three ideas which I submitted to the peer hub, which all three ideas are on fear in community and some confusion in the healthcare workers. So, to release the fear or to increase the immunization by community level, I put the idea that use of the mass media, and second idea that we should use the pamphlets or handouts whenever the ASHA or support worker goes to the survey. But it is very difficult to reach to the community as a large scale. So I put the idea to focusing on the training of the healthcare workers in context of the COVID. So it is not possible to take the training physically. So I put the idea that the online training of the healthcare workers and to increase the activity of the support services. I put an idea, put an the objective that there should be increase in incentive. So if we recognize the work of the support system, then it may help us to improve their work.
Okay.
Yes.
Jyoti, please, if I may ask, what was the focus of the training? What was the training going to be about?
Yes, the focus is on the infection prevention and control practices. And very simple question or very simple queries may the healthcare workers have, that they have confusion that if the child is coming with the mild illnesses, so are we give the immunization to the child or not? They need support from the medical officer. So the training should be based on these queries, what to do, and mostly the infection prevention and control practices.
Okay, and how was the training? How is the training? I'm sorry for interrupting you, but I think it's important. How is this training going to be conducted?
Yes, so we have one batch of routine immunization training. The training module is given by the state government only, and in that training module also there is a infection prevention and control practices. But in context of COVID, the mask is not previously suggested, so we suggest the healthcare worker to put the mask throughout the session, use of the hand sanitizer, and social distancing the major issue, because where the immunization sessions are conducted, these are the small places like Anganwadi or one room of the school. So we suggest that the schools are closed down. So they may use the corridor of the school for the immunization session, so that they maintain the shadow, and also the social distancing, and the beneficiary with the caretakers may sit comfortably with maintaining the social distancing. Also provision of the sanitizer for the caretakers also, because we need to handle that card, immunization card or booklet, so it may be the chance of infection. So one should be very careful while handling the cards or putting the records on the card.
Okay, thank you, Jyoti. Reda just indicated that we are having a first question from on Facebook. So Reda, over to you.
Yes, thanks, Charlotte. Actually, we've got 4 questions. And just for those of you who are joining us midway, this is part of the COVID-19 Peer Hub. We call this the Ideas Engine Live. We finally, I think, found the right name for it. Charlotte Mbu invites one or more practitioners who is working to keep immunization, to keep vaccination going during the pandemic so that children can be protected from vaccine-preventable diseases. So we have, let's see, we have 4 questions. So one is a yes or no. So Rajat Garg asks Jyoti, did you take the RISE training? So that's question 1. Question 2. So let's first, Jyoti, do you want to answer that first? Have you taken the RISE training?
Yes, sir. Actually, I didn't take the RISE training, but I know about the app and I use that app only.
Okay, great. All right. So then Dr. Tanushri Mandal wants to know, has two questions. How was the impression of the ASHAs before receiving online training? And two, was there any noticeable change observed following this training?
Actually, the training is for the staff nurses who are working in the facility or rural hospitals. We didn't start the ANMs training because they all are engaged in the COVID survey and all these activity. And ASHA trainings are planned at the block level by the medical officer and the LHVs. So it is not possible to find out the changes in the behavior of the ASHA because they are given training in very beginning of the pandemic how to practice the infection prevention practices during the COVID, during the surveys and communicating with the beneficiaries.
All right, thank you. The next question is also from Tanushri Mandal. Can you please elaborate more about the incentive process? And Rajat Garg wants to know any issues of logistics like mask or sanitizer.
Yes, sir. There is scanty supplies of the mask and sanitizer at the community level, at the facility level. They may struggling for the supplies, but nowadays they can demand for the buffer stock also. So in future, in nearing future, they may not suffering from the shortage of the material. And incentive process, I think Dr. Tanushri Mandal herself suggest me in the India group meeting that the incentives should not be in form of money only, because ASHAs are provided with the something 150 rupees per session, but it should be in the form of certification or recognition as per the work done by them, that this person may they bring the child more than 70% or 80% or 100%, they will be certified, or it should be written in their progress book. This may be practicable.
Great. Thank you. So we have another question for Jyoti, and then I suggest we go back to Edda from Kenya, so to focus on her project and situation, and encourage those of you who are on Facebook, if you have any questions, direct to Edda. So Mercy Onu Peters wants to know, were the PPE, so the protective personal equipment, provided by the facility or the stakeholders? Did the training you conducted, what progress has the training added? Over to you, Jyoti.
So actually, all the workers are given training in general regarding the infection prevention and control process. They are used to use the mask in all the settings, that during surveys, during facility work, during the outreach sessions and all. But the more is about the use of sanitizer after each beneficiary, and maintaining the social distance is the very new thing. But now we pass almost 6 months of the COVID, and we teach to live with the COVID. So it may be become a regular activity for coming sessions.
Thank you, Jyoti. Back to you, Charlotte.
All right, thank you, Reda, and thank you, Jyoti. I'll turn towards you now, Edda. We want to get into more detail concerning your project, so I'll invite you to unmute yourself. Okay, so please tell us exactly. I wanted to find out from you the immunization data that you communicate within the community to the community. Is it disaggregated data, or is it whole state data, or is it per health facility? How is this data communicated in a way that community members will understand the message?
Yes, thank you very much. The community, the data communicated to the community is in a very simple form. It's disaggregated data in terms of how is the birth OPV, how is BCG. It's kind of tracking down different at different levels, the different levels of immunization. So it's not just a general thing. It's something that the community is able to look at virtually and understand. And if they want to, they can even kind of ask questions to the healthcare professionals. And where it's portrayed, it's not additional work. That's one of the things that the healthcare workers are asking now. Isn't this now additional work with all the things we are doing and the COVID and trying to go also to the community inside to give immunization and to revive the campaigns? So it's not any extra work, because it's just even a community health volunteers who are attached to different facilities can just, write down how the trend is going, the OPV, the BCG, different levels of immunization. So it's disaggregated and very clear and very simple. Yeah.
Okay, and if I may, have you already started, because I think that's a very practical objective and activity. Have you already started implementing, and what have you noticed? Is it creating a positive impact?
Yeah, I decided to go now down to one facility, because it will be very hard to do the implementation like in the whole county. So I mapped down one health facility, which is a very unique facility because it's a government hospital. Previously, it was owned by MSF, but it was given to the government. And it has a huge population because there's an informal settlement, which is, I think, the largest in Kenya, if I'm not wrong. And then there's also the middle class people. So the clients are very many. So I decided it would be much better to start with that, since this is an area that was really affected during the COVID, during the lockdown, with mothers giving birth, some of them not going to the facility, some of them still having doubts, do we go, do we not go, what should we be waiting to be called or something. So this would give a true picture of, the trend, and also how people are now starting to utilize the health facility in terms of immunization. So for me, I felt that would be the best health facility to start with. Maybe after this now, I would be able to, take it up to other facilities. Yeah.
Thank you, Eda. There is a question for you on Facebook.
Yes, indeed. Let me put the question back up. This is from Dr. Tanushree Mandal. Thanks for all the great questions that you're sharing on Facebook. So she says, apart from communicating this data through chalk and talk, did you also try other methods like miking as advocacy measures? Yes, you did mention campaigns. Can you elaborate? Did it involve community leaders, NGOs, other stakeholders?
Yeah, as I said before, this method is just one of the methods to strengthen all the others. Because right now the campaigns have started, the advocacy have started, they're going around in communities with the loudspeaker, encouraging them to come to the health facility is still now ongoing. It's really going down very fast. But this in the health facility is something to strengthen all these other interventions. So it's not replacing them. It's kind of strengthening the other immunization. We are trying as much to reach people as much as possible so that they can come back. They can try come back as it used to be. That's why now I decided on this.
Okay. Another question, Reda?
Actually, two more questions. These are from Rajat Garg. Let me put them up here. So first question is, how is the tracking of unimmunized or partially immunized children being done? And second question, it just actually repeats, how is the tracking of unimmunized or partially immunized children? How is that being done? So question for Eda, I believe.
Yeah, our healthcare professionals, they are really taking this seriously, because now for every intervention or every procedure being done in the hospital, for all mothers bringing their children to the hospital, whether they are sick or not, they are being checked for immunization, the level that if they have received, they have been vaccinated. So whether it's outpatient or they were coming to the clinic or they were just coming for checkup, it's being checked for vaccination. Then also our community health volunteers are really being sent to the community also to go in the area of their jurisdiction, the households that they cover, to go checking each mother and children and the booklets, if it's been marked, if they've been immunized, if they know that they can still come to the hospital now for immunization. So it's really being done aggressively in all corners. At the same time, the administrative, we have people called chiefs. I don't know what they're called in other countries. They're also helping out, in the area they cover, telling all the parents, the mothers, fathers, and the caregivers that they should now take their children to the health facility for immunization. And if there's any child who missed being immunized, they should not fear. They should still take them for immunization. They'll still be immunized the remaining scheduled vaccines. Yeah. So
Okay.
it's really aggressive.
Okay, thank you very much, Eda.
Thank you.
And I'd like to thank Rashad Gak for that question, rather, because he reminds me of the lightning chat we had last Sunday with Laura from WHO HQ that was focusing on missed opportunities of vaccination, and the recording is on our Facebook page. You may want to watch that, because Eda was actually talking about checking the vaccination records of all children that visit health facility, no matter the reason for their visit, and that's actually one way of reducing missed opportunities for vaccination. So now I want to turn towards Jyoti. Earlier on, Jyoti, please can you unmute yourself? Earlier on, you mentioned the IDS engine, that you shared a number of ideas in the IDS engine, and remember, the IDS engine was a period within which 2 weeks, 1,200 ideas came up from scholars of the peer hub all over the world, and these ideas were used to feed most of the projects and action plans that were drawn up. So Jyoti, were there ideas in the IDS engine that helped you to develop your action plan?
Actually, I read many ideas, but I like one idea, that the use of the private practitioners, but it can't fit in my action plan. So I can't it. And the training idea is also given by many of the peer hub peers. So I put some material from their views also.
Okay, that's great. And I know you also contributed a number of ideas into the IDS engine. Now I wanted to find out, you are doing online training, and one of the challenges with online training is internet connectivity issues. How did you get to handle that?
Actually, we conduct the only one batch in this month, and we conduct one training along with one NGO in Palghar district, which is the tribal district of Maharashtra, but it is a physical training. We call for medical officers, block level medical officers, health officers, and some staff nurses as a trainer. They are being trained to train their workers, health workers. So it is physical training, because there is a main issue with the that internet connectivity, and it's very useful. It can it involves all MCH activities and along with the vaccination. So when we move forward towards the training of ANMs in the remote area, we may face challenge of the connectivity.
All right. So thank you for.
Sounds like we just lost Charlotte.
I know we have. Yes, Reda, is that not a question?
No more questions. I thought we had lost you, so I'm glad you're still here. A comment from Dr. Tanushree Mandal: study on pediatricians and private practitioners are also a very vital information who often vaccinate children and is important in COVID-19 context. Thank you. Any further questions, Charlotte, or shall we bring this impromptu Ideas Engine live to a close for today? And of course, for those of you who are participants in the COVID-19 Peer Hub, there is a lot more going on, and you can actually meet and interact and speak with both Jyoti and Edda, who are active members of the COVID-19 Peer Hub, to share experience, spread ideas, and take action to keep vaccination going during the pandemic. Any final closing comments or thoughts, Charlotte?
I just really want to thank Jyoti and Edda for accepting our invitation today. And just to say, apart from being active members of the COVID-19 Peer Hub, they are also taking part in the Impact Accelerator. And I do hope that in the coming weeks, we'll really get to have tangible results of what they are doing on the field. And I just want to pay a special homage to all the healthcare workers that are continue to offer services, especially immunization professionals that are ensuring continuity of immunization services within the context of COVID-19. Thank you very much, Reda, and thanks to everyone that has been with us this evening.
Thank you.
Thank you very much.
And yes, let's keep those thumbs up. We have an amazing 170 thumbs up in 30 minutes and 63 hearts. I'm disappointed by the low number of hearts, but I take heart with the thumbs up. That actually helps Facebook share more, be more likely to share our Ideas Engine live. Thank you.